Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you?
I'm living it up.
Yes. That's what we want to hear. So,
and I'm laughing. You want to know why?
Yes. Always.
Nita, what do you call a boomerang that never comes back?
Boom, boom, bye-bye.
That's good. A stick.
That's a good one.
You want to hear it? You want to hear a joke about paper?
Paper, always.
Yeah. Never mind. It's terrible. Why do people send me these? I don't know.
Oh, my God, that is hilarious.
They love them. They love these little dumb jokes. It's a good way to start the show. Anyway, Nita, what we're talking about today is how to heal musculoskeletal orthopedic pain. So I get people in all the time ready for a surgery on their knees, shoulders, neck, back, toes, fingers, you name it, hips. And we're typically able to heal them if I choose properly. I can't heal the whole world. And listen, a lot of people do need surgery, but I'm going to just say it like this. Don't kill the messenger.
Right.
A lot of you guys out there have had surgeries that didn't work. I know that because I get patients in almost every single day that have had failed surgeries. I'm going to give out the phone number right now, and you will get a free copy of my book, which I'm showing to the camera right now, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. There's a wonderful foreword to the book by the lovely, as you say it, Suzanne Summers, who is an advocate of my work. I've worked on her and her family for many years, even her grandkids now. Time goes by. You'll probably have a few things to say, Nita. But first I want to say, besides doing the musculoskeletal system, we also do the top of the head for people that are losing their hair, using platelets and stem cells to rejuvenate the hair follicles and thicken up your hair. And what else do we do? The vampire facelift. It's a procedure where we inject the face, we numb it up so you don't feel very much, and a few pokes later with your platelets or stem cells, and it regrows the collagen and thickens it up in the face because, as we know, collagen dries out. The body is made out of collagen. It's the structural protein. And for those of you that have arthritis and your cartilage is worn down, collagen is the major constituent in the cartilage. So it's been a great treatment on my body. Nita, I know your neck was healed up by it. And
right.
I've used it on both my knees, my shoulders, my elbows, my wrist. I've had other doctors do my neck and back. When I go to national meetings, I'm the first guy that raises their hand to be an example for everybody else, because there aren't many guys that know how to do this well. And be careful who you go to. You want to make sure that your doctor, if you go to do regenerative medicine, as we call it, that's regenerating the cells in the body, regrowing the tissue. You want to go to someone that does it all day long, not someone who plays around with it once in a while. So the number to the studio right now, you'll get a free copy of my book. Give me a call now. You can talk to me live, local, as Dr. Jean used to say. 866-870-5752. I'll repeat it a couple times for those of you grabbing your pens. 866-870-5752. We would love to talk to you. We'll take good care of you, and we'll be nice to you. And the number once more is 866-870-5752. We want to hear about what your musculoskeletal complaints are. What hurts? What hurts in the body? And you can see if you can stump me and see if there's something I don't know. I don't know everything. And my patients teach me a lot every single day. They come up with new things I haven't even read about yet. And then if you want to catch me at the office or find out more, we have staff waiting around by phones all the time. And that number is 800-300-9300, 800-300-9300. And for those of you that want to watch videos of me doing these procedures, you can go to the website, which is www.lastemcells.com. And there are many articles there about regenerative medicine, about sports injuries, about growing hair, about treating the face to make you look prettier. And it's a giant website. And on every single page, there's a spot where you can email me. So if you want to talk to me by email, you can go to www.lastemcells.com. The lawyer in me threw out the word law there for a second.
Yeah, a little blast from the past there. I like
Yeah,
it.
a little Freudian slip, as they say.
Well, do you want to talk a little bit about generally how the treatment works while we're waiting
that's a
for
great
callers?
That's a great idea.
Oh, did you mention the free book they get when they call? That's very important.
That's right. You get a free book, free copy of Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a $25 book. I'm looking at it now. It's got photographs of these treatments. It's got photos of a lot of sports guys doing stuff. And there's 184 pages that's chock full of research. Doctors always say, where's the research on regenerative medicine? Well, it's right in my book. There's 264 studies on regenerative medicine and why really surgery is not the best course of action. It was obviously for many years, surgery was the, I wouldn't say the only option, but what orthopedic surgeons were looking at. Now, orthopedic surgeons are starting to do stem cells and platelets. Thank God, it's a lot easier and very minimal side effects to it. So actually what I'd rather do, Nita, is go to a question, then I can weave in how these treatments work.
Great idea.
So this one says torn rotator cuff stem cells. Let's see what the person wrote. Okay. Can a torn tendon in the rotator cuff be helped by stem cells? Yes. We do it every day. We get many people in with torn rotator cuff tendons. Those are tendons like the teres minor, the supraspinatus, the infraspinatus. The supraspinatus has the most tears. And most guys who are athletes, I would say, I'm going to make up a number, by the age of 35 or 40, have a torn rotator cuff in the supraspinatus tendon. I have 3. I have a subscapularis, that's one of the rotator cuff tendons. I have a subscapularis tendon, that's the one that pulls the arm inward toward the body. I have one in my supraspinatus tendon that helps to elevate the arm. And then I have what's called a labral tear that's in my shoulder. And I don't have pain in my shoulder. As a matter of fact, I'm raising up my arm and shaking it to the camera right now. And I am going to go play golf today, and I am going to hit the ball as hard as I can because that's what I enjoy about sports. Unfortunately, that's how I get injured because I was always, from being a little kid, I was always doing sports like crazy. And then in high school and college, I did gymnastics, and I beat myself up pretty bad. I'm a well, not anymore, but I used to go in the ocean quite a bit, surfed, windsurfed. I run, and I played a lot of tennis in my day. And I'm not happy just doing a sport unless I'm doing it hard and trying to do it as perfect as I can be. So I'm a repetitive athlete also. I do things over and over, and I've injured myself over and over and over. I'm 74 now, and I'm doing pretty darn good. And when I was in my 40s, when I learned about doing regenerative medicine of platelets and actually, it wasn't platelets and stem cells back then. It was called prolotherapy. But back in the day, I was a wreck, and I'm in much better shape today, 30 years later, because I self-inject. So if I get injured, I just inject myself. So it's been really, really amazing. So the question of this person is, can a torn tendon in the rotator cuff be helped by stem cells? When I do it, I mix up the platelets and the stem cells together to get a double type of a treatment rather than just one or the other. But either can be done separately also. And the question always is, will that tear heal up? So I'm an empiricist. That means someone who looks for the end result. I want to know that myself and my patients feel better and can do whatever they want to do. I don't go back and get an MRI to see if a torn rotator cuff or a labrum or something of that nature has, quote, healed or come back together. It's irrelevant to me because studies show that many, many people have pain, terrible pain, that horrific pain, and they don't have anything wrong that can be found on an image like an X-ray, CT, or an MRI. So the reverse is also true. If you have a tear, that doesn't mean that's the pain generator. So by injecting these areas, and when I do let's say a shoulder, I do what's called comprehensive regenerative medicine. That means you can have a little teeny tear. I'll inject that because I use an ultrasound which can look inside the body so it can guide the needle. If you're ever getting shots in your shoulder, your hip, or your knee, among some other areas, please make sure your doctor uses an ultrasound. Otherwise, it's called a blind injection, and they don't work very well. But at any rate, I do comprehensive regenerative medicine in most areas, and I'm going to hit all the areas that I think are the pain generators. I'm not going to treat based on an MRI. I'm going to treat based on the examination. So as an example, if someone has a labral tear in their shoulder, that may not be the pain generator. It may just be the supraspinatus tendon that is worn down or has a tear in it. So how do I find out? I touch the area. We use what we call the jump sign. If you touch it and it hurts, the person goes, ouch, that area needs to be treated. So it takes a lot of treatment in terms of teaching the doctor where to treat. I've been doing this 25 years. I do it all day long, every day of the week. Anything you want to add, Nita, before we take another question?
Yeah, I'd like you to give the phone number, and I want everybody to know when they call the program today, they get a free book. It's, excuse me, it's your latest called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies.
I do want to mention also that Suzanne Sommer, who's one of the greatest proponents in what's called alternative medicine, which to me is not alternative, it's the real medicine, the natural medicine,
right,
has the introduction to this book that she wrote. And she also wrote another book, which is, her books are typically interviews with doctors to show what they do. And her other book that came out last year has an entire chapter about the work that I do in regenerative medicine. And I don't remember if it talks about her success with it and her family's success or not, but it's a very lengthy chapter on regenerative medicine. Do you know the name of that book, Nita?
Yes, it's A New Way to Age.
It is. I just looked over my shoulder and saw it sitting there.
And pages 302 to page 316 are exclusively about your work.
Yeah. And I love it. I love that Suzanne is a proponent of things that basically don't hurt people. And we know that the number 3 cause of death in our country is iatrogenic. We have heart disease, we have cancer, and then iatrogenic causes of death, which has to do with doctor-created. Going into hospitals with infections, doing surgeries that cause infections, mixing up medicines that shouldn't be mixed together. My point of view is get people off of medication, do things naturally, use natural herbs and supplements and things of that nature. I'm going to give out the phone number again, and hopefully you'll call in and talk to me about what your issues are or your family or friends. And the phone number to call me and talk to me live right now is 866-870-5752. If you're driving, try to pull off to the side of the road so you're safe, and get off your Bluetooth so we can hear you. And again, the number is 866-870-5752. And if you want to call the office and get more information, the number to the office is 800-300-9300. And once more, if you want to go to the website and email me, the website is www.lastemcells.com, and you can watch me doing videos of these procedures and see me injecting all over the body. I don't inject just knees or shoulders or hips. Anywhere there's pain in the body, I inject from the head all the way down the back and the front. I'll do ribs for costochondritis. A lot of times people have their chest cracked for different reasons, heart surgeries, and they end up with rib pain. That's called costochondritis. We can help fix that. Actually, there's a treatment that I do for what is it called? The herpes that goes around the body, not just genital or lip herpes. It is called what, Nita?
Like the virus thing you're talking
about? The virus thing. Darn, I'm blocking the name.
That's why you have me.
That's right. You're my peripheral brain. But what's the name of it?
I'm transmitting to you as we speak.
It's so common too. You get on. Are you on the internet, Nita?
I am.
Why don't you go look it up? It's a herpes simplex, but and there's it's a viral shot that you can get that is very good for people not to get it. And there's a treatment I do that's called neural therapy that can help get rid of that very quickly. And there's a chiropractor that I refer to named Randy Weinzoff, who had a very bad case of it all the way from his back around his abdomen. And we did the neural therapy on that, and we got rid of most of that pain in a few minutes. We had to do it a few times.
So are you looking for a cyclovir?
No, that's a medicine.
Yeah, so you're looking for...
The name of the syndrome.
Oh, well, that's just called herpes simplex.
Well, it is, but there's another name. When we get older, we get it.
Oh, I know what you're talking about.
Yes, you do?
Yes.
Don't you love when you get blocked on a word?
Yes.
You know, in medicine, in med school, we learn, supposedly, 12,000 new words a year. It's an entire language. And it's a great language. I love it so much. So let me go to another question here, and then we'll see if we get any callers at 866-870-5752. We had somebody that just hung up, darn it. You can call back if you like. I would love to talk to you. And come on, Nita, keep thinking, keep looking.
Well, I am still looking, and it's very interesting because it's not telling me what I want to know. But I
look
think
up the word
I'm
zoster. Look up the word zoster. Z-O-S-T-E-R.
Okay. So that's interesting.
And there's still
something also that happens with something that people get with measles later on.
Actually, it's chicken pox. You're close. And what people end up with is when they have an outbreak in their elderly years, they get this herpes zoster, and it is called, guess what? Shingles.
That's what I knew it. That's what I was trying
knew
to
it
find.
too.
Yep. Good for you. All right, you get points for that.
So I'm going to go to another question, if you don't mind.
Okay. Well, I'll give the phone number first for a quick second, 866-870-5752. Please do give us a call.
That's right, because otherwise I'm going to torture Anita with a joke that she doesn't have the answer to. This one is, it says, knee, little cartilage left. Let's see what the crux of this question is. Oh, it's a long question, so I'll read it quick. Everybody listen. Is it possible to have a knee significantly that has very little cartilage left? Yes, the answer is yes. We just inject platelets and stem cells there and regrow the cartilage. Along with having a root tear fixed, but the meniscus is very thin, I think it may have a slight tear. There's a popping noise whenever I stand. The popping noise generally is not from a meniscus tear. It is from the patella, that's the round bone in the front, popping out of the trochlear groove in the femur, the thigh bone. And that's very common. That's called crepitus, or grinding. Person also says, I have rheumatoid arthritis, which has led to a left knee replacement twice. Ooh, first one didn't work. A left hip replacement 3 times. Well, that sucks. A right hip replacement twice. 4 2-foot-long titanium rods in my back, along with 73 screws and rods holding my back together, along with both of my shoulders, also having complete arthroplasties like my knees and hips. I didn't include the 30-something other surgeries that were performed before my arthroplasties or the 7 additional back surgeries I've had since the first. I've always loved bodybuilding, and even though I'm 61, go to the gym 6 days per week. Wow, that's pretty good with all this stuff going on. Because I had 12 left knee surgeries before having the arthroplasty, plus 2 right knee surgeries, I've hardly been able to spend any time working on my legs. That's in the gym. Thus, the question regarding my knee with very little cartilage left. Unfortunately, I've been able to work the last 6 years, 1 surgery after another, so I do not think I will be able to come in to do these treatments. Well, that's sad, because these are the treatments that could heal your body even after the surgeries and could help you not have to have any more surgeries. Let's see what it says. Okay, what else? Anyway, he signs his name sincerely, and I won't give out his name. I'll keep his privacy. But, again, don't kill the messenger. That's me. I'm going to guess all these surgeries didn't have to be done to begin with. And I treat people with rheumatoid arthritis all the time, and I don't like to do it during a flare period where the joint is red hot, but when it quiets down, using regenerative medicine can help regenerate the tissue in the joint. So this is a very odd case to me with all of these surgeries, but it does happen. And there's many times when I see people come in after failed surgeries like this, where I touch the area and I go, I can help you. And they go, you got to be kidding me. And I go, no. Those surgeries, I don't want to look backwards, but very often they didn't have to be done. And I know, Nita, you're breathing, which means we have Betty on the phone, and she has a question about her right knee. So, Betty, Dr. Marc Darrow, how are you today?
Hi, Doctor. Hello?
Yeah, do you have a question for me? I'd love to answer it.
Yeah, your voice was disappearing. I couldn't hear you.
I'm sorry.
I've seen you in the office, and you examined me, and you told me to lose weight, and I have.
Good.
And I'm trying to see if it's going to be on the workman comp. Are you doing workman comp?
I don't do workers' comp, but they often will pay for this. You have to check out with your lawyer or your insurance adjuster.
I talked to the claim adjuster. She said if the orthopedic doctor say that I need stem cells, then they will pay for it.
Okay, well, you answered your own question then.
Yeah, but my thing is, she said you have to be part of the Corvell group.
No, I'm not part of that group. So listen, let me explain something. I don't know about any group, but often workers' comp does pay for it. And do you have an attorney by any chance?
I don't have to have an attorney. This is
I didn't ask if you had to have. Do you have an attorney though?
No, I do not.
Okay, good.
I had one, but not now. This injury happened many years ago.
I got you.
And they retired me under disability that I could always have someone to take care of me.
Well, Betty, if I said I could help you, then the answer is I can probably help you now that you've lost the weight. When people are morbidly obese, I don't remember you, so I don't remember your body style or whatever. But we know that a lot of people that have obesity will end up having arthritis in their knees because of the excess pressure. Every pound, Betty, that is on your body in excess is 5 pounds of pressure on your knee. So I don't know how much you lost. If you want to come back in, I'm glad to look at you again. We're going to the break, everybody. If you want to reach me live right now in local, 866-870-5752. The office number, if you want to get a hold of the staff, is 800-300-9300. Thank you all. We'll be right back. Hang with us.
You're listening to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we'll be right back after this message.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.